Hello, Dr. Willis. My name is Ty Canish, and this is part one of 4 video sessions for the NURU 642 Psychotherapy Didactic Course Signature Assignment. First, I will be discussing 3 different therapy modalities to be integrated for best patient outcomes. Integrated therapy, according to Zarbo, Casca, Catafi, and Campari in 2005, is preferred since they have found that there is no single psychotherapy approach or theory that can be appropriate and or effective for all patients and or their problems. Furthermore, integrated therapy allows the therapist to tailor the therapy to the client, paying attention to the affective, behavioral, cognitive, psychological levels of functioning, and to spiritual and cultural beliefs, allowing the therapist to tailor their knowledge of evidence-based treatments and approaches. Another main emphasis of integrative therapy, psychotherapy, is a therapeutic relationship between the therapist and the individual. This is considered a key element for client motivation and therapeutic change. These different approaches may be used consecutively throughout the therapeutic process, or they may be used as a single combined form of therapy. Because integrative therapy identifies these key concepts that are appropriate for each individual client, it can be utilized for all ages, genders, cultures, and spiritual considerations. The 3 therapies that I have selected to use for this client are motivational interviewing, cognitive behavioral therapy, also known as CBT, and Gestalt therapy. Next, each therapy will be summarized identifying the key concepts. In 1991, Miller and Rolnick told us that motivational interviewing builds on Carl Rogers' optimistic and humanistic theories about people's ability to exercise free choice. This capacity allows individuals to change through self-actualization. As a counseling style, it can be used as a first step in developing a therapeutic relationship with the client with the goal of eliciting self-motivational statements and an eventual behavioral change in addition to creating client-identified enhanced motivation for positive change. During the therapy sessions, 5 principles for the therapist are required. The therapist must express empathy through active listening. They must help to identify discrepancies between client goals, values, and their behavior. They are to avoid arguments and direct confrontation with the client. They are to adjust to client resistance rather than forcing a client to change inappropriately, and of course to support client self-efficacy and optimism. There are also 5 changes that are identified, and the client, with the help of the therapist, will actually move through each of the 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. Moving on to cognitive behavioral therapy, Wheeler, 2015, and Beck, 2011, tell us that cognitive behavioral therapy is a form of therapy that is based on the correction of cognitive distortions. It has been widely researched and successfully utilized for many psychological and even medical conditions, which are evidence-based. CBT utilizes Socratic dialogue and questions to guide the client through answers that elicit automatic thoughts and to help identify those thoughts that may be illogical and need a change to influence then a change in behavior. As in motivational interviewing, there are rules that the CBT must abide by, but there are more plentiful, actually 12 of them. And while some of them are familiar, there are some very specific to CBT, such as the dialogue must be goal-directed, the questions must be short, focused, and targeted, questions must be planned and asked in a logical sequence, negative answers must be reframed and re-asked, and the therapist must continuously monitor client mood to pace the content appropriately, among other similar behaviors. CBT also revolves around the triad of thoughts, feelings, and behaviors, and with homework, another hallmark of CBT, it helps the client toward a change in thoughts and therefore behaviors. CBT homework activities include, but are not limited to, journaling, specific workshop activities such as automatic thoughts. There's a copy of this in Appendix A of this dialogue. ABC analysis or case formulation, muscle or breathing relaxation towards mindfulness, unraveling cognitive distortion with restructuring. Gestalt therapy is a client-centered experiential approach to psychotherapy that helps clients focus on the present and to understand what is actually occurring rather than what they may perceive to have happened based on past experiences. In this therapy, clients cannot just talk about their emotions, but are encouraged to focus on the present and experience feelings through reenactment, often called empty or even open chair. Through this role-playing interaction exercise, with the therapist acting as the moderator, it will assist the client in understanding the 2 points of view that may unfold. And now a little bit about the history of my client. Amelia is a 62-year-old professional Caucasian, non-Hispanic female. She has been married for over 12 years to her second husband. Overall, the relationship is very compatible and still contains elements of romance. However, her husband also exhibits obsessive-compulsive disorder at home. Examples include washing her coffee cup before she has finished drinking it, and even making her bed one early morning when she got up to use the restroom. Recently, her 92-year-old mother started having health and memory issues, and having only one remaining sister who lives in another state is the sole caregiver. At home, she is always on alert when the phone rings and is feeling guilty that she cannot keep the house clean as she feels she should. In fact, she's beginning to think that her husband is watching her all the time to make sure she doesn't make any messes, making her further think she must be an untidy person and can never live up to his standards. However, at her first visit, she does present in perfect dress with matching shoes and jewelry. For this client, motivational interviewing will help establish the therapeutic relationship and determine the client's stage and willingness to change her ideation. CBT will be utilized to assist the client in identifying irrational thoughts and feelings, with homework to try out new strategies, and finally, Gestalt therapy. We help to use the client come into and stay in the here and now instead of thinking about the own new future based on past experiences. This is the end of part 1. We'll now be waiting for my client to show up, and we will do our first motivational interviewing session. This is part 2, a brief history of present issues in psych mental health and motivational interviewing. Good morning, Amelia, and welcome. As you know, I'm a psychiatric mental health nurse practitioner student at Bremen University. With this and 2 additional sessions, while this and 2 additional sessions should be helpful to you, I need your permission to record them for a class assignment. These recordings will be reviewed only by my instructor for grading, although our sessions will continue to remain confidential and only between the 2 of us. And only a 20-minute recording sent to the instructor. Could you please verbalize that you consent to these sessions being recorded and submitted as part of my learning assignment?
Yeah, I consent, and and thank you for not putting my name in that box. I prefer that you put client. I like that.
So thank you very much. We also have been given instructions to keep this MP4 as an MP4 file, or we can upload it to YouTube. Do you have any objections to me uploading it to YouTube?
How will it stay private?
It would probably have to be locked, but if you prefer, I can probably just send the MP4 recording.
Okay, I'll leave that up to you.
Okay, and I'll let my instructor know. So getting past that, and thank you again for your consent, could you please tell me in your own words what brings you here today?
Well, you know, I've got an older mother. She's in her 90s, and she's having some struggles with her memory, and I don't know. It's just a stressful time for me. I'm married for the second time. My husband and I we love each other, but he is really into cleaning. I don't know what else to tell you about that. You know, I just feel like he's picking up after me all the time.
And that's uncomfortable for you.
Yeah, it stresses me out. Yeah, it stresses me out.
Okay. Thank you. I do want to get a little bit more of medical and mental health history, just so we can both know how best to proceed if there's anything in your past that we may to address first. Tell me what brings you here today, but could you tell me if you've had any other psychiatric histories, such as diagnosed disorders, past therapies, medications, group sessions, prior mental health providers?
Well, I was in a long-term marriage. I was with my husband from the time I was 19 till I was 40. And towards the end of my marriage, I did seek some counseling and go to group therapy to help me through that process. But that's about it.
And at that time, what did they say was happening with you? Did they give you a diagnosis, or was it just a support group, or?
I didn't get any diagnosis. No diagnosis.
Okay. And you didn't take any medications?
No. Okay,
very good. Thank you. So besides that, have you had any past traumas or violence have had an impact on your life or your well-being?
Not really, except for, of course, divorce, and I lost a brother to suicide when I was, in my 50s, I think. He had a long-term diagnosis of bipolar disorder.
Oh, okay, so you have that in your family, but no one else besides your brother, your mother or father that you remember, your sister?
My mother has had depression most of my life.
Okay, thank you for sharing that. But other than that, for you, it sounds like your life has been pretty good. Any alcohol or illicit drug use, hallucinations, or ideation of harming yourself or others now or in the past?
Not for me, no.
Okay, very good. Thank you. Um, could you now share with me how you describe your mood today?
Well, actually, I'm just I'm a little bit tired and burnt out today.
Hmm.
Um, yeah, mostly because I had to take my mom to the dentist and for memory testing today.
Oh, that must have been very stressful for you and very uncomfortable. When you get tired like this, what do you do to make yourself feel better?
Oh, gosh, I usually just after after I'm with my mom, I try to come home and rest and maybe just listen to some oh, what are those called? My kid gives them to me. Podcasts.
Some podcasts, okay?
Yeah.
Uh-huh. And
Or a relaxation tape. I've got some of those too.
also that does help you. Very
Yeah,
good.
it does.
And so this is how you approach your current disturbance in your life. So that's good. Do you think you'll be able to change your feelings at some point with your mom?
Well, I think with my mom, I need to just deal with what is and just make sure that I do good self-care right now.
Hmm.
So,
And then tell me a little bit about you being uncomfortable with your husband. How does that make you feel, and how often are you feeling like watched? I think was your word.
well, uh, that's been going a little bit better, but I do attend to making sure that I have everything picked up before he gets home from work. I do that. And that, you know, reduces my feelings of being picked up after or whatever.
Do
Yeah.
does it make you feel anxious?
Mm, it's hard for me to discriminate between the fatigue I feel caring for my mother and any anxiousness I have
Yeah.
regarding, it seems like it's all mixed up together to me.
Okay. So hopefully we can change some of those perceptions into some positive thoughts rather than having you feel stressed or feeling anxious or whatever those feelings are that you're having. So for this session, we're going to be using a worksheet at the end. And what you're
Okay.
going to do is you're going to fill it out, and it's going to help you identify a little bit more about what you're thinking, a little bit about those automatic thoughts. Like you said, you felt like you were being watched by your husband. And these are actually called, I'm going to find my notes here. Um, these are actually called, not perceptions. Oh my gosh, I lost my thing here. I'm just going to pause this till I can find my spot. All right, and I apologize for that. What you'll be doing is using a worksheet that'll help you identify some of the triggers and then what your automatic thoughts are. And those automatic thoughts are actually core beliefs. And then we'll just make sure that we can work towards a goal of making you feel better. Maybe not so fatigued because perhaps your fatigue is also related to these thoughts, and so that's something we can work on in the future. Um, let's see. I'll go ahead and give you the worksheet, and what we'll do is we'll get back together next week, same place, same time. If you would like to do that, would you like to have another session with me?
Oh, that'd be great.
Okay, great. And he'll
Appreciate your
take this.
help.
Oh, you're very welcome. And so this is the end of part two. Wonderful. I'll see you next week. And this will conclude part two.